UK's National Health Service is again under the radar. A study has found UK citizens die sooner from cancer and heart diseases than people in other rich countries. The main reason, it stated, is the lack of beds and staff. According to a report by King's Fund think tank, the NHS has been affected by years of underinvestment, while adding the number of avoidable deaths could have been prevented had patients received better treatment. The study includes 19 rich countries and it concluded that Britain has below average health outcomes because it spends less. The report compares the resources available to the NHS across the United Kingdom and with those of the health systems in countries including France, Germany, Sweden, Japan, Singapore and the United States. Apart from this, King's Fund also acknowledged that NHS's lack of doctors and nurses are also one of the main reasons why the service is struggling. Later this week, the UK government is also expected to publish the long-awaited report on NHS. UK Prime Minister Rishi Sunak touted it as one of the most significant announcements in the history of the National Health Service. And for a more comprehensive understanding of the matter, our correspondent Alex Aizat sent us this report from London.
The reports from the British pharmaceutical industry and King's Fund have suggested that it's not just the lack of people in the NHS that aren't helping it, but it's also the lack of equipment. There is just not enough, which is showing that the UK's NHS is not just crumbling within this own country, but also within the other countries, and it's one of the lowest. And that is quite a sad state of affairs, especially because the UK has the NHS as this huge high point. And Rishi Sunak, Prime Minister, said that it was one of his 5 promises to ensure that it was going to be working for the whole nation. In fact, there was 50,000 nurses supposedly being coming on board over the next year, and he was suggesting that he was going to bring them. But sadly, that does not seem to be the case as yet, and people are still dying of a whole host of conditions that could have been treated if there was more staff, if there was better equipment. Now, the government has said that there is going to be billions of pounds put into the NHS, but it may well be too little, too late. We've heard today as well that the independent review suggested that there should be a 6% pay increase for NHS staff, but the government hasn't confirmed whether or not they are going to implement that into the next financial year, because they keep talking about high inflation, and they do believe that giving extra pay rises would mean inflation stays higher for longer, which is going to be a huge problem for those within the NHS who are wanting better pay and better working conditions, or they are leaving, and that then will have an even worse effect on the NHS and also of the state of health to those within the UK. It does feel like it's a never-ending circle at the moment, and we are seeing still more strikes, specifically from the junior doctors going ahead into the summer. There needs to be more money, and there definitely needs to be more people coming into the NHS to help fix it. At the moment, it does feel like it's crumbling away. This is Alex Aizat reporting from London for WION. World is One.
WION is now available in your country. Download the app now and get all the news on the move.